The trends are deeply concerning. Cases are doubling every 10 to 12 days now. By mid-October, Ontario could see 1,000 new cases a day.
New COVID modeling in Ontario. The province says cases are doubling every 10 to 12 days and could reach 1,000 new cases a day in the first half of October. The Ford government has closed strip clubs, limited hours of operation for bars and restaurants, but in the wake of these new numbers, is more action needed? We did request an interview with Health Minister Christine Elliott, but her office declined that request. We have reached Stephen Del Duca, the leader of the Ontario Liberals. He's in Toronto. Hi, Mr. Del Duca. Good to see you as always.
Good afternoon. Thanks for having me on, Bashi.
We wanted to talk to you today, not only because Minister Elliott would decline our request, but because you met with the Premier. You actually had a meeting today. He met with, I think, representatives from the other opposition parties as well. How did the meeting go?
Yeah, so the Premier and some of his cabinet ministers did meet with myself, the leader of the Green Party, and a representative from Ontario's New Democrats. And, you know, I went into the meeting really hopeful that we were going to get a lot of substance from the Premier and his team about exactly what their plan looks like to deal with numbers that are escalating rapidly here in the province of Ontario. I will say off the top that I was initially encouraged because I did ask the Premier to make the kind of meeting that we had today between himself, his team, and the opposition leaders a standing, regularly scheduled thing. He committed to do that. I'm hoping our next meeting, we're calling it Team Ontario, will take place next week. I'm looking forward to being back in that room to continue to provide constructive advice. But we heard nothing today about concrete plans to deal with the steadily increasing numbers that we see, the kind of steps that we've seen taken in Quebec so far. I didn't hear anything from the Premier or his team with respect to them having a real firm grasp of what to do next, and that's deeply troubling.
Yeah, I wanted to ask you sort of about what that part of the conversation was like and what you are hoping to see from the government. As you mentioned, we're waiting to hear more from Quebec. They've made some pretty significant announcements there that come into effect tomorrow, and the Premier is expected to speak to them. Premier Ford keeps getting questions from reporters. Are you going to follow suit? And today he gave a pretty, I think, lengthy answer on that idea and whether or not, for example, they're going to shut down all the bars, all the restaurants, that kind of thing. He talked about a more regional approach and that he didn't think it was necessary at this juncture. Do you think it is necessary? Like, are you looking to see a full rollback into stage 2? Or are you kind of okay to go through the regional approach, whatever that may be, I guess?
So I don't know anybody in Ontario who wants to go back into a full lockdown. Certainly I don't. At this stage, I don't want our schools, for example, to close. And in order to make sure that we don't end up in that spot in a few weeks, because the numbers have climbed dramatically over 1,000, for example, we need that regional, strategic, or surgical approach, somewhat similar to what's taken place in Quebec, I believe, in Ontario. We know that in the GTA, we know that in Ottawa, the numbers are climbing in particular. We know that there are various kinds of settings, could be in bars, could be in other places where people are getting together and not paying attention to the rules as closely as they should be. And so, yes, in order to avoid a full lockdown, which nobody, least of all me, wants, because that would be horribly, horribly crippling for all of us, I think the Premier needs to step up right now, make that critical decision around leadership and get the job done. And you heard nothing in so far as the Premier responding to that? Like, did he indicate that that was at least on the table for consideration? I asked the question directly of the Premier. The Minister of Health was in the room. Dr. David Williams was in the room. They gave us lots of answers. They danced around it a little bit. It sounds to me like they're still mulling it over. I don't really know what they're waiting for because we've seen the numbers steadily climb. And I don't, it's like an ounce of prevention is worth a pound of cure, is the old saying. So if you listen to the Ontario Hospital Association, you listen to leading epidemiologists and other healthcare experts, they're all saying the same thing. Show some leadership now. It's not going to be easy. It's not going to be painless. There will be people who will be adversely impacted by this kind of decision, but at least in an isolated regional surgical way, make this decision for the next couple of weeks, bring Ontario's numbers back down, and avoid a full lockdown, which nobody wants. Was there anything, just a final question before I head over to that press conference with Premier Legault, but was there any discussion around sort of if that ends up being the case, and since the Premier has cited concern over the economy, are they coming up perhaps with some kind of plan to help businesses in those regions that might be forced to shut down? Again, like, it's hard to imagine a scenario in which they announce that and then don't also say, hey, here's what we're going to do to help you through it. Was there a discussion on that front? So they absolutely do need to make sure that there's relief there for small business entrepreneurs and others who have been hit badly battered by what's already occurred and what might occur if there has to be that kind of strategic sort of surgical shutdown again in certain areas. But we didn't hear any details of that today. Whatever they have in their plan, to the extent that they actually have a plan, they're keeping it well hidden. And I think that that serves all of Ontario very poorly.
Okay, Mr. Del Duca, I appreciate your time this evening as always.
Thanks very much.
Starting at midnight today, we cannot receive people in our homes in red zones. If you're inviting guests for a party, you're breaking the law. When this happens, police officers can give fines of $1,000. If the person refuses to cooperate, officers can remotely ask a judge for a warrant to intervene, which can be given the same evening. For protests, as I said Monday, wearing a mask will now be mandatory. Those who refuse to follow this rule can also get a ticket of $1,000.
Quebec Premier François Legault says he intends to back up new restrictions coming into effect tomorrow. Montreal, Quebec City, and Chaudière-Appalaches will be shutting bars and restaurants. Social gatherings are banned both inside and outside, and fines of up to $1,000 will be issued to those violating the rules in what's known as the red zones. Meanwhile, Ontario put out new projections today that show the province could see 1,000 new cases a day by mid-October. The Ford government, though, added no new restrictions. Why the difference in approach, at least at this point? Let's get the power panel in Toronto. Tim Murphy, Managing Director of Macmillan Vantage. Summa Strategies' Tim Powers is here in Ottawa, as are Kathleen Monk of Earnscliffe Strategy Group and Sherelle Evelyn, Managing Editor of The Hill Times. Hi, everybody. Nice to see you.
Hey.
Kathleen, let me start with you. So the pressure keeps kind of amping up as these numbers and data, and especially the new modeling, comes out today in Ontario. Quebec is taking, at this point, a very different approach. I'd be surprised. My understanding is, for example, Cabinet in Ontario is discussing some more restrictions as we speak. So I would be surprised not to see some more. But so far, a lot of resistance to the idea of like completely shutting down.
And days of resistance from Premier Ford, right? It was days ago that the Ontario Hospital Association came out and actually called for a reversal to move back to stage 2 in certain jurisdictions like Ottawa, like Toronto, the Greater Toronto Area, that have been more impacted by recent COVID cases. But despite those calls from authoritative figures to take more action, Premier Ford has been like weeks late, inconsistent, and frankly, his plan is still hugely contradicts his actual words that he's using. Like, for instance, I know not everybody actually watches all of Ford's press conferences. I do. And so one of the things I found astounding today was almost like his cognitive dissonance today in the presser, where he was angry at the federal government for their slowness in uptaking certain new tests that he would like to provide to Ontarians. And he used the phrase, vite, vite, federal government, hurry up, get moving on this stuff. Well, the same could be said for Ford. We see what's coming down the road. They predicted the modeling 1,000 cases per day by mid-October. There are clear actions he could take now. He could cap class sizes at 15. He could hire a bunch of new personal support workers and give them fair wages and full-time jobs, so not part-time minimum wage jobs. He could have more infection controls in our long-term care facilities, but he's the one who's sleepwalking into this crisis without stronger plans. We know that Ontario has consistently followed Quebec, and it feels like Ontario's a bit flat-footed.
So Tim Powers, I'll have to qualify each time tonight, I don't know if that was like a look of pain on your face as your head was moving around, but are you sold on what Kathleen is saying?
Oh, it's only the pain, because usually I'm looking directly at Kathleen at night. Now I'm just seeing Tim, so it's the pain of the reflection of Tim.
I have that effect. I have that effect on people.
That isn't me.
Not true.
I share some of Kathleen's frustration, and I agree the province can do a better job, the Premier can do a better job communicating, but I just find this whole thing so maddening from so many perspectives. So let me pick up on a couple of elements of it. Or one that Kathleen didn't touch on, but I think we would probably all agree on. Like, the testing is a mess. Yep. For whatever reason, the money coming late, the government not being prepared, maybe there's some blame on the feds, maybe there's blame elsewhere. I really don't care where the blame is, but I'm sure we all know people who have gone through the testing process or trying to go through the testing process. What took 12 hours now can take 5 or 6 days, or I was told today by a medical practitioner up to 2 weeks. How is that even effective is my question there. So there's a lot of accountability that has to be meted out there. I do support what the government is trying to do on tactical, localized approaches. Kathleen referenced the Ontario Hospital Association that said we needed to step back to phase 2. There are 21 physicians who came out today, many leading epidemiologists, who said the government, at least philosophically, and was getting there in practice, was getting it right on the localized shutdowns. I think more work needs to be done there. My bigger frustration, and I don't know if this is solely the government to blame or not, is I just wish we had all a comprehensive picture of the data that's out there, because there is so much generalized anxiety being caused for people, Vashi. People look at case numbers, but if you don't understand the context and the hospitalization, this is causing so much unnecessary other health turmoil that we're going to have to clean up for years. So I don't think that all can be put on Doug Ford, but it's certainly of great concern to me. Just in that vein, though, and Sherelle, I'd love to get your take on this. I think the number, like, I would love to know, for example, what's driving the policy decisions. So obviously we know the case counts, but if you're going to decide to shut down restaurants, or you decide to go for banquet halls, or like, I only have anecdotal things for mayors saying, in Brampton that the problem is weddings, or other politicians saying it's backyard get-togethers. Is there a transmission problem? Like, where is the transmission occurring? And then how should that inform the policy that's taken? There is no public transparent, like, we are in the dark completely about that. Sherelle, what do you think about that?
Yeah, I mean, I would agree. And the Ford and team were asked earlier today, what is the rationale? We can't see it like we could earlier in the spring. It comes down to, I suppose, again, it comes down to resources. The local health authorities need the money or the resources, whether it's people, time, whatever it is, to be able to to not only do the contact tracing, but also to then disseminate that information. There are some local health authorities that can tell you, okay, this case came up because of a wedding. This case came up in school. But other local health authorities only tell you, okay, there was a person within this age range and they've caught COVID and everybody figure it out. So it's a huge issue, not knowing what's going on. By looking at the age ranges, people are making a lot of assumptions as to where the transmission is coming from, saying, it's young people, it's parties, not thinking about the fact that, back in the spring, young people were, all the universities shut down, schools weren't open, restaurants were closed. These are all places where young people not only live and work and study, and now they're all open. So these are places where they're in contact with the general public and they are catching COVID from somebody and spreading it to somebody who may not be in that age range or may be asymptomatic. So it's a big issue in terms of data and having the resources to get that data to people.
Tim, Kathleen and everyone else gave us an overview of the kinds of asks there are, the pressures that are on the Premier to kind of do something more. I don't know if there's a consensus about exactly what that should be, but there is a feeling of apprehension, especially, I think, after hearing that modeling about whether or not, especially in those hot zones, the right approach is being taken. We don't have that data. I just don't know if that pressure goes away. Like, I think there's going to be stuff that's coming. Like, I can't imagine in the next 24, 48 hours they don't announce more stuff.
Well, one would hope so. I mean, I think you know, after I think, to be honest with you, when at the start of this, I think governments were given the benefit of the doubt by the populace as because they were reacting in real time, and people kind of understood that and said, look, we expect the yardsticks to move every day as our experience moves every day. But I think the problem, you know, governments are facing, particularly in Ontario, is I think people no longer prepared to give them benefit of the doubt, and rightly so. Because I think there are 3 failures in the government response in Ontario, and you've identified clearly one of them. I think the degree of transparency around data, which may be a collection issue or a sharing issue, I don't know, but the lack of transparency is a huge problem for gaining trust, governing our behavior, allowing us to sleep at night. Secondly, I think the government has failed on the notion of proactively building steps. It seems to be reacting all the time. I mean, you look at any kind of reasonable math application of cases and the reproduction factor for this disease, we could be near 3,000 cases a day by the end of October, based on the current trajectory, which is crazy unless serious measures are taken. And then the third thing is there's this weird kind of skinflint attitude in the provincial government to spending money, which is frankly, it's getting in the bucketfuls from the federal government on responding to these issues. And you kind of put those 3 together, and I don't understand why they aren't doing better. They really should be.
Well,
go ahead. I think the modeling example is a fascinating one because if you remember, we were given federal models before. I think it was late March, early April. No, it would have been April, was it not? Those federal models came down from Dr. Tam, and I wonder if the same intent and purpose that came with the Ontario models today was the one that was in play then, which was by seeing the worst case scenarios, by seeing how dramatic it could be, they were again trying to reinforce the need to exercise more control and behavior. That doesn't excuse or disabuse the data, but I think there's a political communication strategy to it. I think Premier Ford and a lot of the other public health officials could learn a lot by watching the public health officer we have here in Ottawa. We are very
or in BC.
Yeah, I mean, Dr. Etches here in Ottawa is a fantastic communicator who takes the time to walk people through in very consumable language what they should and shouldn't be doing and doesn't scare them in the same vein. And I think that's part of it. The government seems to have lost its mojo, and I think Tim's probably right. Experts were given the benefit of the doubt, and politicians were put in the benefit in the expert category. They may not be there right now.
Okay, Kathleen, I know you want to jump in. Just 15 seconds, if you don't mind. I have to take a commercial.
I just wanted to point out the fact that Tim Murphy is right, that a story was done out of Toronto, Queen's Park a couple weeks ago now that said 97 cents out of every dollar is being paid by the Fed. So really the Ontario government can, COVID money that is, the Ontario government can stand up and do more on this issue.
Yeah, I mean, they would argue, and the Premier makes sure he points it out at every press conference, that they're spending on LTC, at long-term care, for example, they're spending on testing, but I take your point. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.